Knock, knock.
Hello?
Hey there, I'm Grace. I'm going to be your student nurse for today. We're going to do a venipuncture on you, which is going to draw some blood to do some samples to test various different things the doctor's ordered. Is that going to be okay?
I guess. Your 2 patient identifiers.
Can I get your name and date of birth? And I'm going to look at the wristband.
Mary Johnson, 2/22/82.
Great, that's who you are. I'm going to pull the curtain for privacy, wash my hands. I'm not going to put on gloves yet because I want to use my bare hands to feel and test for veins, right? Okay, so what's next?
Test various veins and select one. Apply tourniquet correctly.
Okay, so I'm going to look at the different vein options. I'm going to avoid anywhere that has any scars, any lesions, or any scabs. Feel for whichever vein I'm going to do. I'm going to go for this one right there. Okay?
Apply tourniquet properly.
I'm going to put on the tourniquet. So you're just going to do it above, let's say if I'm doing it right here, you want to go 3 to 4 inches above where you're going to do your site. So you pull one side, pull it tight, tuck it under. It's like, you're going to leave it there, okay? What next?
Have patient make a fist with their hand, cleanses the area thoroughly, and allows alcohol to dry.
Okay, so I'm going to have the patient make a fist so they can clench their hand. I'm going to now put on gloves, right? Because now that I'm cleaning it, I don't want to get my dirty hands on them. I don't have an alcohol swab.
Do we have an alcohol swab?
Thank you, ma'am. I'm going to get my alcohol. I'm going to cleanse the area in circular motions.
That's cold.
Yeah, I'm sorry. It's a little cold there for you. Okay, now I'm going to sit here and wait for it to air dry. Okay, it's dry.
Attach vacutainer to butterfly needle.
If necessary. So this one is necessary. There's no vacutainer associated with this one. So you got your butterfly needle here. Take off the cover. This is your vacutainer. You're going to put it on. If it already has a vacutainer on it, you can skip that step. Okay?
Remove needle cover.
So at this point, you're going to take this part off, put that somewhere.
Anchor the vein with the thumb of your non-dominant hand far enough that the needle will not touch the thumb as it enters the vessel.
Okay, so like I was saying in my video, you want to hold the thumb with hold the vein with your thumb so that it doesn't roll. But before I do this would be a great time to have your tubes nearby, right? So you don't have to like try and reach all the way over here. So make sure you have your tubes close, and you're gonna have to know what tubes you're getting, right? So you're gonna, on your checkoff, you're gonna have an order sheet saying which labs to get. So my order sheet says a PTT, a lipid panel, and an H&H. You need to know that that means I need a blue tube, a green tube, and a what?
Purple.
Purple. Right, and so what order does it go first? Which one's first?
Blue.
Green.
Green.
Purple. So I know that I can ignore these. I'm not going to need them. Okay? So, going back, where am I at?
Hold the butterfly needle, bevel up, facing, and insert it at a 30-degree angle with your dominant hand.
Okay, so I'm anchoring the vein. Gonna insert.
No.
All right, we're gonna pretend there's flashback because there's not gonna be any. You see the flashback in the tube? What am I gonna do now?
Reviews order sheet and gathers needed blood samples in the correct order.
Right, so we did that. I'm gonna pop in. You can do this one-handed. Practice doing it one-handed. Pop in the blue. Pretend it's gotten some blood in it. I'm gonna take this one out. Gonna get the next one, green. Get it in there. Pop it on. Fill it up. Get the next one. All right. So
Release the tourniquet immediately.
Okay, so I got all my tubes. First thing I'm gonna do is pull off the tourniquet. Okay, that's the very first thing you do. Okay. Now what?
Withdraws the needle and places in the sharp.
Okay, next thing I'm gonna do is pull the needle out.
Applies a dry gauze pad and pressure to the sites. When bleeding has stopped, applies an adhesive bandage.
Okay, so right now I'm gonna hold pressure, right? And if this was a real patient, you could tell them to hold pressure for it themselves while you pull the needle up like this, you know, so the needle's covered. Put it in the sharps, okay? Then you can resume holding pressure, and that's when you'd get your tape or your Band-Aid or whatever. And, well, I should have done this before I started.
It's okay. I'm bleeding out.
No, you're not. We're gonna tape that on there, okay? So it's got pressure.
Throw away all trash, remove gloves, and perform hand hygiene.
Okay, so I'm gonna take all my trash, my gauze, tourniquet, whatever, anything that's trash, put it in my glove, take it off like this. I can throw that in the trash now. Wash my hands.
Places labels on the tubes with patient info and time.
Okay, so I got my 3 tubes that I got with my order, right? The doctor ordered a PTT, a lipid panel, and an H&H. So I'm gonna say, I'm gonna get my patient labels. We're not gonna have those for your check off, but in real life, you would just stick a label on each tube with the time that you did it. So I'm like, oh, it's 9 o'clock. You put 9 o'clock on there. Okay, so I labeled my tubes.
Prepares them in the baggie for transport to the lab with their requisition slips.
Okay, so I'm gonna open up my biohazard bag. I'm gonna put the tubes in there. The requisition form will just be the order sheet that you guys get in the beginning that says, you know, what you're ordering at what time, and that's gonna go in here. So we'll pretend this is our order form. That'll go in there. And then you verbalize, this is going to the lab. Okay.
Documents the procedure, which labs were drawn, sites of venipuncture, time of draw, and time sent to the lab.
Perfect. So you would just mention that you got it from the patient's right inner forearm or right AC. You know, I guess that's the inner forearm there. The time, whatever time it is, 11:45 on whatever today is, the 18th. Yes. I think 11:18. Patient tolerated well. Sent to lab. Got the PTT, the H&H, and the lipid panel, and that's what you do.